Governor Asa Hutchinson has set a goal that half of Arkansans be vaccinated by the end of July.
But there's still hesitancy in many Arkansans to get the shot. Our Jay Bird joins us live tonight in Pine Bluff with more on where the natural state stands in terms of vaccinations. Jay.
Yeah, good evening, guys. In fact, Jefferson County, where we're at right now, still one of a lot of counties that are still well below 50% vaccination population within their counties. And they are not alone across the state, as I mentioned here. But providers such as those here at the Jefferson Comprehensive Care Center are doing their best to try to educate people to put their minds at ease. Carla DeVos is an APRN at the Jefferson Comprehensive Care Center. She says the vaccine is safe, but admits even she was hesitant at first.
I had fear of the unknown, and fear of the unknown can keep us from getting the help that we need.
She says much of the initial fear had to do with how quickly it was perceived the vaccine was developed.
When the vaccine first came out, a lot of patients' fear was that they're putting something extra in the vaccine.
They just heard all kinds of rumors.
Sure.
You know, they're going to put a chip in you and all this stuff.
Gary Kuhn has gotten his shots, but says some of his family doesn't want to.
They're just hesitant. They're scared. They're afraid. They've heard stories about it making them sick.
DeVos says different groups have different reasons for being unwilling. She says blacks lean on the history of being tested on, Latinos fear being turned in, and whites just don't trust it. She says providers across the state have done their best to educate in order to alleviate any fears or concerns, and says word of mouth from peers has been the best way to go about it.
If you have someone that is of your color taking the vaccine and can tell you the true possible side effects of it, then they're more susceptible to taking the vaccine.
DeVos says age and connectivity are big factors also.
Some of our patients are older. They're not using a smartphone. Some of them still have a flip phone.
Kuhn says his side effects were minimal, but understands everyone will react differently. But he says those normal, short-term side effects shouldn't deter anyone.
I didn't see no problem with it whatsoever. I advise anybody to get it.
Now, DeVos also tells me that many people do rely on their local health care clinics for a myriad of things. She said they trust them a lot because many people, they've been going there for a long time. In fact, the Jefferson Comprehensive Care Unit, or Care Center, I should say, is actually going to start administering COVID-19 vaccinations on Monday. And they say anybody who wants to get a shot or even talk about some of the side effects of those shots, more than welcome to walk in. You don't have to have an appointment, and they will definitely assist you with any paperwork that might be necessary. But for now, live from Pine Bluff, Jay Bird, Fox 16 News.